Welcome to our video on lower limb fractures. In our last video, we discussed upper limb fractures, and today we'll focus on the various fractures that can occur in the lower limbs. We'll cover different types of fractures and explore the key aspects of these injuries. Lower limb fractures are frequently encountered due to road traffic accidents, sports injuries, and falls. These fractures can lead to significant immobility, deformities, and potentially damage to blood vessels or nerves. Medical professionals utilize classification systems to assess the severity and location of these fractures. These systems are crucial for guiding the appropriate treatment plans, ensuring patients receive the necessary care for optimal recovery. Femoral neck fractures are often seen in elderly individuals, especially those with osteoporosis, which weakens the bones. These fractures typically occur after a fall on the side. The Garden classification system is used to assess the severity, ranging from types 1 to 4, based on the stability and displacement of the fracture. Potential complications include avascular necrosis, where the blood supply to the bone is disrupted, and non-union, meaning the bone doesn't heal properly. The diagrams show the difference between a subcapital neck fracture and a transcervical neck fracture, illustrating the location of the break within the femoral neck. The next slide presents intertrochanteric fractures. These fractures occur in the hip area and are also common in elderly women, often resulting from a direct impact on the hip due to a fall. Compared to femoral neck fractures, these fractures generally have better healing outcomes. However, there is a risk of the leg becoming shorter or turning outward during the healing process. Proper management is important to minimize these complications and ensure proper alignment. The next slide details shaft of femur fractures. These occur in the long part of the thigh bone and typically result from high-energy trauma, such as car accidents or significant falls. These fractures can be quite serious, potentially leading to a condition called fat embolism syndrome, where fat particles enter the bloodstream. Additionally, there is a risk of significant blood loss with these fractures. The image shows a fracture in the shaft of the femur, highlighting the break in this large bone. Proper medical attention is crucial for managing these fractures due to the potential for serious complications. The next slide covers distal femur fractures. These fractures occur near the lower part of the femur, close to the knee. They can be categorized into supracondylar and condylar types. These fractures are typically caused by direct trauma to the knee area. There is a risk of injury to the popliteal artery, located behind the knee, and stiffness in the joint can be a potential complication. The image shows a fracture in the lower part of the femur, near the knee joint. Prompt diagnosis and treatment are important to avoid vascular complications and preserve knee function. This slide describes patella fractures, which involve the kneecap. These fractures can happen from a direct blow to the knee or from a sudden, forceful contraction of the quadriceps muscles. There are different types, including transverse fractures, which are the most common, and comminuted fractures, where the bone breaks into multiple pieces. A key feature of a patella fracture is the inability to straighten the leg at the knee. The image shows a fractured patella, potentially being stabilized with wires or pins. Proper treatment is necessary to restore knee function and stability. This slide describes tibial plateau fractures. These are fractures of the upper part of the tibia, which forms part of the knee joint. They are often caused by valgus or varus forces applied to the knee, meaning a force that pushes the knee inward or outward. These fractures are common in sports and road traffic accidents. Complications can include post-traumatic arthritis and ligament injuries. The Schatzker classification system is used to categorize these fractures based on their severity and pattern. The image shows a fracture in the upper part of the tibia, affecting the knee joint surface. Proper diagnosis and management are crucial to ensure proper joint alignment and prevent long-term complications. Tibial shaft fractures affect the main part of the tibia, the large bone in the lower leg. These fractures are quite common and can be caused by direct trauma, such as a hit to the leg, or by twisting injuries. There is a risk of these fractures becoming open fractures, where the bone breaks through the skin, and a condition called compartment syndrome, which requires immediate medical attention. The image shows a fracture in the main part of the tibia. Proper diagnosis and treatment are important to allow for proper healing and prevent complications. Ankle fractures involve breaks in the bones around the ankle joint, such as the tibia, fibula, or talus. These fractures can happen from twisting injuries, direct blows, or falls. There are various types of ankle fractures, depending on which bones are broken, including lateral malleolus fractures, which affect the fibula, medial malleolus fractures, involving the tibia, as well as bimalleolar and trimalleolar fractures, which involve breaks in 2 or 3 different bones around the ankle. These fractures can cause significant pain, swelling, and difficulty walking. Proper diagnosis and treatment are essential for proper healing and regaining ankle function. This slide describes Pott's fracture, which is a specific type of ankle fracture involving both the lateral and medial malleoli. It's often referred to as a fracture dislocation of the ankle and typically involves widening of the ankle mortise. The usual mechanism for this injury is an outward twisting force applied to the ankle. This type of fracture is quite serious and requires careful treatment to restore proper alignment and prevent long-term problems. The image shows a fracture involving both sides of the ankle joint. This slide discusses calcaneal fractures, which are fractures of the calcaneus, or heel bone. These are the most common type of tarsal bone fracture. They typically occur from a fall from a height, with the person landing on their heels. Complications can include subtalar arthritis and heel deformities. Calcaneal fractures are also sometimes called lover's fractures. The image shows a fracture in the heel bone. These fractures can be very debilitating and may require surgery to properly restore the heel shape and function. This slide describes talus fractures, which involve breaks in the talus bone, located between the heel bone and the leg bones. These fractures can occur from forced dorsiflexion of the foot, such as in motorbike accidents. A significant risk with talus fractures is avascular necrosis, where the bone tissue dies due to a poor blood supply. Talus fractures are also sometimes called aviator's fractures. The image shows a fracture in the talus bone. Proper treatment is crucial to preserve blood flow to the bone and prevent long-term complications. This slide discusses metatarsal fractures, which are fractures of the long bones in the front of the foot. The slide mentions two specific types: Jones fracture, which is a fracture at the base of the fifth metatarsal and carries a risk of non-union, and March fracture, which is a stress fracture of the second or third metatarsals. These fractures are often seen in military recruits and athletes due to repetitive stress. March fractures are also sometimes called soldier's fractures. The image shows a fracture in one of the metatarsal bones. Proper diagnosis and management are important to ensure proper healing and prevent chronic pain. Thank you for watching the video. I hope you found it informative and helpful in understanding the different types of lower limb fractures.